This topic I've talked to a lot of you about. I think probably in a one-on-one situation. It's something that I've been learning about probably really more in depth since March of this past year, when I was learning more about environmental illness as well as chronic illness. And so it's become really apparent to me how important this topic is. And so when we talk about resiliency, we'll just talk about its impact like on our health and how that is impacting all of us. I think we all certainly recognize trauma in a big sense in our lives and in our professions, and allowing us to actually see things as potentially traumatic experiences also then allows us to realize that we need resiliency, and how at different times we have various amounts of resiliency and feel like things stress us or don't stress us. So you guys know who I am for the most part, I think. And, you know, I would say it was really through some of this chronic illness education that I could really start to understand how much of a role this is playing for all of us, really. So objectives today, we'll just talk about what is resiliency, what's trauma, understanding the impact of trauma on our brain, and I'm going to go through a little bit of anatomy. So I will go through it, try to go through it relatively slowly, but also with some expedience to get through all the information. I'm going to check one thing. Let's see, make sure we got. There we go. All right. If everybody thinks we'll get, I'll make sure that everybody stays muted here. So if we talk about resiliency, by definition is the capacity to recover quickly from difficulties, toughness, or also the ability of substance or object to spring back into shape. So that is kind of, for us, it's how we can endure some sort of stress and then, you know, reasonably respond, but other times how when we have stress that maybe we don't respond so quickly. So that's kind of the concept of resiliency. When we look at trauma is actually an interesting thing to start to talk about. We're all really aware of, you know, distressing, disturbing experiences, physical injuries. But I think, you know, beyond the classic war, assault, accidents, natural disasters, a lot of times understanding how much trauma can really impact us in terms of even betrayal, loss of control, helplessness. And I would even say, you know, I kind of get into pain, confusion, stressful situations, relationships, like those can be traumatic events for us as well. I would also say in this day and age, we deal with a level of trauma related to sometimes social media. You know, we have a whole different level of what's happening here for people. And so that, that poses in itself another, probably a bigger issue now. I think about our cell phones and the availability that we have. Those can actually be sources of trauma, or maybe trauma is not the word, but certainly stress for us, and that is having an impact on all of our health. In terms of signs and symptoms of trauma, certainly a lot of us are really aware, you know, pending the trauma, loss of someone, whether it be anger or grief or sadness, maybe fear, denial, sometimes shame, anxiousness. Physical symptoms, really, you know, pain, nausea, diarrhea can be, you know, symptoms when you get shaky, dizziness, sleep disruptions, headaches, become exhausted. And, you know, those kind of things when we talk about in the context of some more chronic illnesses, and some are just the things we deal with day to day. You know, there's a lot of overlap, like, well, do I have chronic fatigue, or is this something else, or how much of this is stress? And we'll get into a little bit when I talk a bit about different sympathetic responses and where we are in terms of what we need normally in terms of physiology, and how we can see where we or others, maybe if we're dealing with a child or a parent or a loved one or even a friend, how we might be able to recognize, like, wow, somebody's kind of maybe stuck in this pattern of reacting. When we talk about the brain on trauma, I'm just going to walk you through a little bit of this. I will make sure that this gets posted basically on the clinic YouTube site so that you can actually look at some of these things again. When we really start to talk about our brain, one of the first places we think about is our amygdala, and it's basically our fear center. And when we're in a traumatic situation, or if we're chronically stressed, that area can actually be overactive, if you will. And the main purpose of that area is to really determine, you know, if a person, place, situation is like a threat to our well-being and impacting our safety. And so this is one area that we need to work on, you know, bringing that fear factor down. And certainly, I think a lot of people can relate at different times that we feel like we're on edge and always kind of afraid of what's next. When we go into one of the next centers is the insula, and this is the main area of how we internalize experience and internal sensations. So, you know, certainly, like, this could be hungry, jittery. When this area gets disrupted, it's harder to manage our emotions and distressing physical symptoms. So sometimes I would think with like irritable bowel kind of symptoms where you could have some dysregulation in this insula area. When we move to the hippocampus, you know, that's our memory center. And the interesting thing about the hippocampus, especially when we deal with trauma, is this is kind of our time stamper, if you will. And in the sense that, like, when, you know, if you have a traumatic event, you know, this will timestamp it. This can actually become underactive and dysregulated in the sense that your mind, you don't end up timestamping that, saying like, oh, this is in the past, this is not anymore. You know, I would say when I was speaking to the paramedics and firefighters in Wasilla about this talk, I relate this to years ago. I got in an accident. I spun out on black ice and flipped the truck, and fortunately I'm fine. But this is one of those things where if I'm driving and it's rainy, it's icy, and I start to feel like a vehicle sliding, that automatically just like triggers that anxiety in your chest. And so, like, that's one of those things, like, I mean, I guess I would use that as an example of how this can become dysregulated in regard. And so for me, it's that trigger of sliding that can trigger that. And that's a hippocampal memory. When we start to think about our prefrontal cortex, so this is that area of our brain, that's our thinking center of our brain. In small children, you know, this is the part of the brain that's underactive, like, because it hasn't developed yet, not necessarily in a bad way. But when we get stuck, and I'll explain this a little bit more coming up here, when we get stuck into this fight or flight situation, we're not spending as much time thinking. And that I think when we have some dysregulation with stress, this explains why, like, sometimes you can't slow down and think. When you get put on the spot in a situation, it's harder to be able to, you know, respond maybe exactly like you'd like to. Another part of the brain that's of interest is your cingulate, and this is basically our self-regulation center, and this helps us regulate thoughts, emotions, conflicts, that when we get in stressful situations also becomes underactive. And when you look, kind of more of our cortical thinking, some of the self-regulation. When you think about if you are in a situation of potential harm, you get in an accident, some of those things, like some of this stuff is not working as well because you're really down in your brain stem, which is really our primordial brain. And because you're just thinking about survival, you need heartbeat, you need blood flow into your muscles, you need those kind of things. And so with really being able to get an idea of like, oh wow, when you see somebody stressed out, you're like, why did you do that? And people will say, I don't know why I did that. And when we look at things from this way, then we can be, if anything, more forgiving to ourselves and forgiving to those maybe in those situations, because we can start to understand there's some physiology behind this. It's not just because somebody's not thinking or they're, being unkind intentionally or however they're responding. They're through these different ways. This is also going to help us when we think about how we can control and impact things. I'll talk a little bit about how we can use some of our cortical thinking to downregulate some of these things, how we can actually do some exercises that will regulate between our insulin and amygdala that actually helps us with some of our fear center stuff. Hopefully so far this is all making a little bit of sense. This is a big slide with a lot of busyness on it, and I don't want to be off-putting to anybody, but I want people to understand a little bit about the vagal nerve. And the vagal nerve is our 10th cranial nerve, and I'm going to show you next a little slide of the brainstem that kind of shows us why smiling can help us, singing can help us, different things can help us with our vagal nerve. The vagal nerve is really interesting in that it tends to be the nerve that can kind of slow things down. It's the parasympathetic system. It's that rest, digest. And as you can see, like the vagal nerve, man, it connects, to our lungs, to our heart, our liver, our spleen, our gut. And so it's really, really important part of our self-regulation and basically non-conscious control. There's a couple of different parts of the vagus nerve, and this only from an understanding, a basic understanding. There's the dorsal vagal complex is primitive. Like this is like, it's unmyelinated. It tends to be slower in terms of responses, and this is just reactions down here. So that's everything kind of below your lungs. When we get into above that is the basically the ventral part of that, and that's basically myelinated. It's smart. We can actually work to inhibit some of these things a bit within our control. Just to show a little bit of relationship. So the vagus nerve is really key in what we're talking about in resiliency. Glossopharyngeal and hypoglossal, those are tongue motion, our mouth, facial nerve, that allows us to smile, all of those things. Same thing with trigeminal. When we get into oculomotor and trochlear, you're looking at that's kind of ear things, and hearing. Olfactory is our senses of smell. But you can see all of this stuff is in a really small area, and that will, that just helps from a kind of an anatomical, I guess, explanation as to why some of these things that I'll talk to you about next hopefully will make a little bit more sense. So it's groundwork, if you will. So an important thing in resiliency is polyvagal theory, and this is something that was introduced by Stephen Borges in 1994. For those of you that I've talked with about this already, we've talked about The Body Keeps the Score. It's it's just been a really important book that I've read this year, and that is, Bessel van der Kolk, the author of that, talks about this vagal nerve and polyvagal theory in there. This also is been a topic of discussion in all the chronic illness and environmentally acquired illness conferences that I've been to about how we can get stuck in different states, if you will. And so for me, it's been learning how much this plays a role in our ability to heal and our resiliency and bounce back to what would be a normal state. So Porges kind of describes the nervous system. He uses it like an upside down triangle. And this I kind of talked about a little bit earlier. And the point of the triangle, so like down by my thumbs, is your brainstem. And so the body's sending all these neural signals up here. Depending upon which state our brain's in, whether we're in a flight or fright, whether we're in a parasympathetic rest and digest, really kind of dictates how much of that nerve impulse can get related higher up in our brain. And so when we feel safe in a situation, we can think, we have good self-regulation, all of those things. When we're not in a safe place, when you're scared, you're running, you are in chronic pain, that's harder to do because those nerves are getting stopped in terms of their transmission, if you will. And so Porges talks about a term here, neuroception, and that's the ability of our nervous system to assess whether we're in a safe or dangerous situation. And that's one of those just things that happens. We're not thinking about that. And, fortunately, most of us have that very well intact, that like we know when we're in a safe place, and you can feel, it also helps you understand too why sometimes you walk into some place and you kind of get a weird feeling. That's kind of that neuroception. Is this safe? Is it not safe? Or even is it just more of a stressful or an anxiety-provoking situation? This is Stephen Porges' definition of polyvagal theory, and he just does a really nice job describing kind of how our autonomic nervous system, so that is that system that's starting in our brainstem and just works, keeps us breathing and alive, but how it's influenced by the central nervous system. It's sensitive to afferent influences, which can be things coming back to us, the reception through our body, characterized by our adaptive reactivity dependent on the phylogeny. And when you talk about phylogeny of neural circuits, that's talking about the shift from kind of reptilian to human now neural circuits. Interactive with source nuclei in the brainstem. And I guess part of my reason for going back to showing you the, let me go the other way. He talks about how our facial muscles are in play, and that's where you can kind of see this is in such close proximity that we can actually engage different things with our vagal nerve using our face, which is kind of cool. So to get into kind of this polyvagal chart, I think most of us can relate in some way, and if not, hopefully I'll explain it well enough. So when we're kind of in a green state, we're socially engaged, you're safe, you're oriented to the environment. This is kind of where I was talking a little bit about this ventral and dorsal vagal components. Ventral is, we're alive, we're here. We can operate faster, we're calm, we have more curiosity, compassion, you're more mindful. When you start to go up into the flight or fright, so say you're in an accident, say you're just in a situation that's not comfortable, or you're in pain. A lot of different things can do this, and this is normal. We need this flight or fright sympathetic activity because it helps us get out of places, but you're hyper aroused and you're just alert. We can go way into a point where you basically kind of freeze. And it's interesting because it's another aspect of the parasympathetic nervous system, which you can see, but this is that primordial sense. This is the reptilian, and this is why, like, when you see a little salamander and different reptiles, they actually like freeze. Frogs will freeze. And this actually, in some sense, can happen to us. Fortunately, it doesn't happen, so often, but we have to be very careful with certainly babies with lesser developed nervous systems can actually, kind of freeze. And that's where we have to be careful monitoring heart rates and blood pressures and those kind of things. So this in and of itself, this is a normal thing to sometimes get up here, but we want to be able to come back down. And this is this idea of resiliency. When people are starting to deal with chronic illness, you can really kind of get stuck somewhere along this line. And so I think mostly being cognizant of that, for me, it's been learning to be more cognizant and understanding this, that then I can help perceive where people might be having more trouble. I can see this sometimes in my own life where, I mean, I think we all can in day to day when you're like, you get stressed. But it's learning to just recognize it, and then we can do something about it. So this chart is actually really neat in terms of being able to see, think about if you have small children, like, you know, if they really get in trouble and they know they did something wrong, you know, they may be in this little freeze spot, and you've got to kind of help bring them back out of that. But also when they come back out of that, you might get somebody like, they may be angry, they might be afraid, and they kind of might panic a little bit on the way to getting back down to like, okay, we can calm down, re-engage in a conversation, those kind of things. So this, I think we can use this in a lot of different ways in our life, you know, just in general. And for me, it's just been really helpful to really help understand where I am myself, where I can see different people at. And I just think it's neat stuff to learn. Moving on a little bit, we'll talk a little bit about some strategies to deal with this as well. I would say, you know, 100% of us, we deal with trauma and stress every day in our lives, you know, with our families, with our careers. And, you know, and by virtue of human connection, we are also exposed to stress that others are under as well. And I think being cognizant, like I just said, of this with ourselves and with those that we interact really can help change our understanding and interactions in a positive way. So lastly, we'll talk about some strategies to deal with this. And I like to think about it when we go back to, if you think about where that brain was, we have kind of our cortex, and that's our thinking part, versus our primordial part. We can do kind of top-down strategies, and that's being able to use the capability of our brain to process stress, trauma events. We can also use bottom-up or movement-based activities so that we can do different things. We can sing, we can smile, different movement things. And then there's also some integrative strategies. So to talk a little bit about top-down strategies, this is where I often talk with people a little bit about meditation or prayer. Oh, all right, we got 10 minutes. Meditation or prayer, visualization, mental imaging, tapping is something that people can do. Journaling helps here. Certainly if you're doing any therapy, cognitive therapy can certainly help, whether it is trauma versus non-trauma focused. EMDR, which is eye movement, that can actually help with some, especially kind of in the PTSD arena, that will help, as will brain spotting, and that's a bit newer technology. And I know people in the Valley that do all of these things, and so I think they can be really helpful. I've had some experience with brain spotting, and that's a pretty neat therapy where you just find that we all have a spot in our visual field at which we can feel things more intensely if we're focusing on them. And through focusing on that spot, you can actually kind of let your mind work through things, and it will bring down heart rate then, and bring down any discomfort you might feel somewhere. It's a pretty neat experiential therapy. In terms of bottom-up strategies, I've talked to a lot of people about 4-7-8 breathing. So that's breathe in for 4, hold it for 7, exhale for 8. For anybody that does any yoga, you can do the alternate nostril breathing. That's another thing. Diaphragmatic breathing, so just lying, sitting, or standing. You can have your hand on your chest or your belly, and you're going to breathe in, and you can feel your chest rise, and then feel your belly rise. And just doing things like that will actually help. And I think many of you that have tried that, you know, it can help really bring your heart rate down, and that will impact that vagal nerve and help bring you back down into that safe place. Yoga, Tai Chi, Qigong, walking outside in nature, dance, any forms of exercise and martial arts can help us. Interestingly, using an eye pillow, so that pressure on your eyes activates the oculocardiac reflex. That will actually help bring your heart rate down. Singing, Again, some prayer meditation, whether you're sitting in poses, kneeling, those things can help as well. In terms of interactive strategies, and communication is interesting because you can tell when you go in and speak with somebody, if somebody using a lot of tone, calming, melodic voice versus a, sort of quick, flat, sharp, no tonal change, how that can make you comfortable versus uncomfortable. We use social engagement. We use our eyes, eye contact, facial movements, smiling, those kind of things to interact with one another. If somebody, when I was first talking about this, I was talking with firefighters and paramedics, and how, like, if somebody's really shut down, say somebody has been in a car accident, sometimes being able to get that person, like, just breathing, get somebody standing up really slowly can actually kind of help re-engage that sympathetic system to get your heart rate back up. And I think interactive play, like, an interesting thing about interactive play is, and I hadn't thought about this very much because I haven't been a dog owner since I was a child, but dogs, when they're playing, are always face to face. Even if they're growling at each other or barking or nipping, they're face to face. When they are not face to face, then you potentially are running into trouble. Helping people understand what is happening and what they're feeling. And with kids, like, one analogy you can use with that I've learned to use with teenagers that I'd read about is, like, think about if a teenager or a child gets upset, think about like a snow globe. I like to explain, like, we have to, like, let the glitter settle before we can start to have a conversation, because if the glitter is all over and somebody's still really upset, we're not going to be able to have, like, a conversation. And I know for those of you with children, you certainly understand, like, oh yeah, like, and I've had some counselors and stuff start to use that analogy, and they're like, oh, that makes total sense. And I think it makes sense sometimes with kids to understand where they're at. Another thing you can do, there's a basic exercise, and I'll find a handout about this, where you can basically lie on your back with your fingers interlocked, and you put it under the back of your head, and basically with your eyes, you look as far, hold your gaze to the right until you either take a big breath or sigh, and then do the same thing to the left with your eyes till you take a big breath or sigh, and that'll actually reset that vagal tone and bring your heart rate down and calm you down. So that's kind of a neat strategy that you can use. Getting back to our definition again of resiliency, and just kind of wrapping up where we're at, so we have a couple of minutes if there's questions. It's that capacity to recover. So if you think about that bell-shaped curve, it's normal for us to get up into that fight or fight, but also we've got to be able to come down. And sometimes, you don't just generally, sometimes you can go up and down, but a lot of times you have to go back through that again. I use that analogy, like when I used to be in the emergency room. You get into situations and you respond, and fortunately we respond well most of the time, but then how when a whole maybe scenario or situation has ended, how sometimes then your heart rate goes up and you're kind of like, wow, what just happened? And that's basically going back down, and you have to kind of work through that sympathetic response again. So that is not an uncommon response. In terms of I think we've got covered kind of the resiliency, and I will, let me see if I can shut down our video. I want to, I think greater understanding provides us with an ability to share and understand one another better. There is, I've talked to a lot of folks about several of these books here that have been really helpful to me. And if any of you guys want these, let me know. But I'm going to shut down the video if I can figure that out.